Hey guys, welcome back to Clinical Physio with me, Khalid Maidan. It's been a big week in our world as we have just launched our brand new website, www.clinicalphysio.com. This will be the new home of all our content, from free videos to premium videos, from the blog to podcasts. If you like our stuff, check it out and sign up to our news updates so you can get our content before anyone else. Right, so on to today's topic, isometric exercises. Isometric exercises are those whereby a static muscle contraction is exerted, normally against a resistance, whereby the joint angle and muscle length does not change during the contraction. Here's a quick example of an isometric wrist extension, where this patient is contracting the wrist extensors of their right hand against the resistance of the left hand. Everything stays in exactly the same place during the contraction. So these exercises have lots of different uses. In the past, isometrics were often seen as a good way of getting a very weak muscle to fire, perhaps post-surgery, or for patients with long hospital admissions who have been subjected to bed rest for long periods. However, recent evidence has shown that isometric exercises can be an extremely important part of tendinopathy rehabilitation, particularly in the stage of a reactive tendinopathy, the stage where the tendon has become suddenly inflamed, normally because of a sudden increase in loading. For example, my shoulder hurts because I moved house yesterday. At this point in the tendon injury, it is suggested that sustained isometric exercises utilizing that tendon can actually generate a generalized pain-inhibiting response. Sources suggest holding the contraction for between 40 and 60 seconds, with perhaps 4 to 5 repetitions at a time. Make sure you complete the isometric with the joint in a mid-range position, rather than in a position that may compress the tendon, which could be detrimental. Making sure the isometric exercise is pain-free is extremely important. If there is a lot of pain during the isometric, this can suggest we are actually overloading the tendon. We need to give that tendon a load it is happy with, and thus it's important to make sure the patient is pain-free at the time of the exercise, later that day, and 24 hours later. This is because tendons are known to have a latent response to loading, where you may only find out the true effect of activity on that tendon the day later. So here are some common isometrics you may use for different tendinopathies. Here is an isometric for the biceps, as you may use with a long head of biceps tendinopathy, whereby the lower hand is pushing up against the other hand for isometric elbow flexion. Here is an isometric for shoulder abduction, which can be used for the rotator cuff, particularly supraspinatus tendinopathies. Here the patient is pushing their right arm out against the left. Next, here is an isometric for hip adduction, where each leg is squeezing the ball in an adduction movement, which can be used for a hip adductor tendinopathy. And finally, here is a plantar flexion isometric, where our patient is pushing into the towel, very useful for an Achilles tendinopathy. And that completes our video. Thank you for watching, and give us a thumbs up if you liked it. And you can use any of the links you can see here to access our videos via social media, YouTube, and our brand new website, www.clinicalphysio.com. For now, take care and keep watching Clinical Physio.